Irritable bowel syndrome, IBS, is a common disorder that affects the large intestine. Signs and symptoms include cramping, abdominal pain, bloating, gas, and diarrhea or constipation, or both. IBS is a chronic condition that you'll need to manage long-term. Only a small number of people with IBS have severe signs and symptoms. Some people can control their symptoms by managing diet, lifestyle, and stress. More severe symptoms can be treated with medication and counseling. IBS doesn't cause changes in bowel tissue or increase your risk of colorectal cancer. The signs and symptoms of IBS vary but are usually present for a long time. The most common include abdominal pain, cramping or bloating that is related to passing a bowel movement. Changes in appearance of bowel movement. Changes in how often you are having a bowel movement. Other symptoms that are often related include bloating, increased gas or mucus in the stool.
See your doctor if you have a persistent change in bowel habits or other signs or symptoms of IBS. They may indicate a more serious condition, such as colon cancer. More serious signs and symptoms include weight loss, diarrhea at night, rectal bleeding, iron deficiency anemia, unexplained vomiting, difficulty swallowing, persistent pain that isn't relieved by passing gas or a bowel movement.
Food. The role of food allergy or intolerance in IBS isn't fully understood. A true food allergy rarely causes IBS. But many people have worse IBS symptoms when they eat or drink certain foods or beverages, including wheat, dairy products, citrus fruits, beans, cabbage, milk, and carbonated drinks. Stress. Most people with IBS experience worse or more frequent signs and symptoms during periods of increased stress. But while stress may aggravate symptoms, it doesn't cause them. Chronic constipation or diarrhea can cause hemorrhoids. In addition, IBS is associated with poor quality of life. Many people with moderate to severe IBS report poor quality of life. Research indicates that people with IBS miss 3 times as many days from work as do those without bowel symptoms. Mood disorders. Experiencing the signs and symptoms of IBS can lead to depression or anxiety. Depression and anxiety also can make IBS worse.